Good morning, everybody. I hope we have coffee to hand. It's an honour and a pleasure to be here. I look forward to our exhaustive and apparently exhausting discussions over the next couple of days. Is this the right volume for everybody? Brilliant. Thank you. So, in this plenary, I've been asked to provide a brief overview of issues and challenges arising when we share data and samples, and this is to provide a context for our discussions over the next 2 days where we can unpack them in more detail. And the first thing I need to do is acknowledge the contributions of so many colleagues. The statements that we have here are entirely attributed to me, but it's built on a great deal of collaborative research with multiple organisations and conversations with colleagues around the world, 5 of whom are in this room today. So, when thinking about sharing, there are a number of approaches we can draw on. So legal frameworks tell us what we must and must not do when we share samples and data, and they provide frameworks for thinking about how we might own and control materials that are being shared. When we refer to social license, we're talking about society's and public's views about what might be appropriate ways of sharing data, so how they think we should be acting. And the ethics frameworks provide insights into what we ought to do, and insights into how we can address some of the challenges that arise when sharing data. Sorry, I have to operate a laptop and the screen at different points. But also, when we're considering these issues, it's important and useful to perhaps think of 5 overarching themes. There are additional themes, but insufficient time to explore them now. And the first one, as mentioned by a previous speaker, is this background of global inequalities. And the implications, this has implications both for our capacity to meaningfully share data and samples and engage in sharing practices, and it also raises important questions about how we should share equitably. Questions about how policies and practices for sharing should be also arise about how they should be responsive to morally relevant aspects of the research context. Now, in one sense, this is relevant at the micro level. So in our previous research, we talked to participants and tried to determine what might be sensitive uses of data or what might be particularly sensitive kinds of data sets that would need additional protection. And the responses that came back were that these were so context dependent, you couldn't generalize, and pointed to the need to be aware of the research context. And at a macro level, an area where this has been explored in a great deal of detail recently and led in part with Catherine Littler, is looking at, for example, the context of sharing data in public health emergencies and how this might influence, this emergency situation might influence our views about how we should share data. The third area, a theme, recognises the discussions, again, presented by our previous speaker, that there are multiple stakeholders internationally involved in biobanking and data sharing, and at times there might be tensions between their interests and the responsibilities that need to be addressed in considerations about how we should share. The fourth is trust. Now, the importance of trust and trustworthiness in data sharing practices and biobanking is very widely recognised, both as an intrinsic element of good practice, but also as a prerequisite of commanding widespread stakeholder support for sharing. And so researchers discuss the importance of having systems that allow them to fulfil their responsibilities, to protect privacy and confidentiality, and to ensure that data is used and samples are used for acceptable purposes. And patients' trust in researchers and in governance process drives their decisions about whether or not to consent to sharing and the types of control they might seek. And finally, questions arise about the extent to which we should prioritise specific uses of samples and data and the factors that we should take into account when doing so. Biobanking and data sharing have cost implications and opportunity costs, and questions arise about whether and how we should prioritise the uses made of data. And this is particularly relevant when we're sharing finite biospecimens, where there may be real tensions about how we prioritise who should get the data for which purposes. So this overview is very briefly going to cover why we should share, key issues and challenges, and then touch on governance and ways forward. So Practical justifications for sharing data are well known. I won't rehearse them in detail now, but basically that we can do better science, we can verify, expand results, we can address biases and deficiencies, we can address novel research questions, we're going to get better research design, we're going to get more informed research funding. It's a valuable educational resource, and it's actually valuable to increase the profile of data producers. However, there are concerns if we don't share properly, what we're in fact going to do is hamper science. We're going to have flawed secondary analyses that are challenging to address, and we're going to have less incentives and resources for primary research. The focus is going to move to secondary research. And there is, in addition to advances in science, there's also a recognition that these are going to have a translational benefit for health. So we're going to see these evidence-based improving, and this can inform our policy design, our healthcare allocation, our regulatory review, and it can trickle right down to the clinical care that we can provide to patients and participants around the world. And again, concerns arise if we don't do this properly, we can hamper health. We're going to get second guessing, we're going to get multiple competing analyses of the same data sets, and there's going to be the burden of evaluating these and thinking how and if they should be added to the evidence base. We also have explicit considerations of ethics issues, and we have discussions about the consequentialist discussions about the importance of promoting the utility of data sets and to maximise the use made of our scarce research funding. Sharing has also been considered to promote respect for participants. They've contributed the raw material. In some cases, they've undertaken additional research burdens, and making the maximum use of what they've provided is considered appropriately respectful. We also get broader discussions about the importance of promoting scientific values relating especially to openness and cooperation, and a recognition that sharing increases transparency, which can help promote best practices, and finally that sharing promotes public goods. So what are some of the issues and challenges that can arise? And I'll now provide a very brief overview of some of the sessions that we'll be unpacking in Theme 1 and Theme 4 and throughout the discussions. So if we look at respecting participants and communities, one of the key issues that arises and a concern that's most currently legislated and regulated at the moment is how we preserve the privacy of those who've contributed samples and data. I don't know how clear this is, but there are fascinating novel developments in this all the time, so that we're currently building algorithms that can predict your face from your DNA with about a 70 or 80% chance of success. So that we have a number of challenges arising in practice when we're seeking to preserve privacy. So we have questions arising about the extent to which we can effectively de-identify data sets, particularly data sets involving DNA, and when we combine data sets, as is increasingly happening, to maximize utility. And this leads to ethical tensions between how we might preserve privacy and yet make data sets still available and maximize the use that can be made of them. So there's this tension about how much data we take out or aggregate and still maximize the use that can be made of the data sets. And we also have differing views about the implications of de-identifying data and samples and whether or not those are still considered appropriate to come under human participant regulations, and views differ about this around the world, about whether de-identified samples and data require the same protections as identifiable material, and if so, how. And these have implications very much for professional conduct, as it's increasingly likely that we are able to re-identify participants. The provisions that are put in place to undertake such re-identification, but also that has implications for how we talk to participants, how we seek consent for them, what we can promise them in terms of how we're protecting their privacy. Issues then come on to questions of consent and control, and we have questions here about what kind of consent should be sought. Many low and middle income settings we get the dynamic consent processes which involve internet access are not currently feasible, and other seeking to attempt such granulated consent on a case-by-case basis would have privacy implications because you would be recontacting participants. Broad consent has been considered appropriately feasible and ethically acceptable, provided it's accompanied by appropriate governance, which raises important questions about what this appropriate governance should be, given the limitations of individual consent in this area. And we also need to think about situations in which consent cannot be sought when we're looking at valuable archive samples and data sets. Very briefly, we had a paper come out last week looking specifically at challenges arising when seeking broad consent to sharing data. And it was funded by a Wellcome grant to look at complex ethical issues arising when seeking consent. There's no chance to discuss the detail, finding the detail. It is open access. But I would like to notice that even the concept of explaining data sharing and how much information to provide about data can be challenging in practice. And so what we did in this context is we looked at participants in two settings. One is the rural setting of Mae Sot, 500 kilometres away from Bangkok. It's up on the Thai-Burmese border. And participants there have very limited familiarity with technology and mechanisms for sharing. And so the discussions there were about how we might explain how we share and what uses can be made of materials. In contrast, in the very technologically savvy area of Bangkok, participants are very familiar with internet and social media. And there the discussions were about how to explain the differences between their current experiences of sharing online, how sharing data and samples would be different. And one participant said, you really have to explain, this is the opposite of Facebook. So we have these discussions about how to explain what sharing is not. And finally, we have questions relating to engagement and governance, engaging communities in governance. And we have this traditional maxim with populations that have not necessarily been brought into discussions that we have nothing about us without us. And we currently have a system in which control over uses of data is largely influenced by a smaller group of individuals. And the practical value of community engagement to promote understandings of sharing and identify particular contextual and cultural considerations is widely recognised. And this can be particularly important when we have samples that have particular cultural significance. But further questions arise about the extent to how and where communities should contribute to data sharing policies, and even about day-to-day decisions about sharing data and samples, because this can be quite burdensome to be involved in. And we also need to determine how we might respond to differing community views about best practices, and recognising the importance of making sure that this engagement is not just tokenistic, that it's meaningful. Issues then also relate to equitable sharing, as mentioned by our previous speaker. It's been recognised as a key topic both intrinsically and instrumentally in the context of sharing both samples and data. And we have large conceptual questions still arising about how we might equitably share data in terms of what is equitable sharing and how equitable do we need to be when we're sharing samples and data. So if we're looking at this in terms of sharing benefits and harms of data, this is challenging because we still don't have a lot of information about what the benefits and harms and costs in practice are of sharing data. And we also need to look at balancing the rights and responsibilities of different stakeholders to clarify how we recognise those and address tensions. And then we have these questions not only about how we might make data sharing equitable, but how equitable do we need to be? So a minimal standard would be that we don't exacerbate existing inequalities, but there have been calls for a more demanding standard that recognises the importance of actually promoting stakeholders' interests when we're sharing data and not just seeking not to exacerbate them. So, for example, if we're looking with participants and communities, they're still working at different speeds, these two lights, we might look further than protecting their interest about prioritising secondary research that's responsive to their health needs. We know this is a key element to their consent, and what steps we might take to promote their access to benefits of secondary research with non-exclusive licenses or other matters. With regard to primary data producers, as well as their rights to be appropriately acknowledged, we might want to go forth and say, what else do we need to do to make sure that they can meaningfully engage in sharing practices, that they can identify and access relevant data sets and samples, they can conduct secondary analyses that address priorities that they've identified, and that they can take part in global discussions about how we should be developing policies and processes and standards for sharing data. So at the moment, the situation is that equity is referred to in policies, but there's not a great deal of detail about how we might promote it. And as Elizabeth Pisani mentions, it's often reduced to norms for citation and authorship. And what we find in practice is that there are concerns that this isn't even sufficient to avoid exacerbating inequalities, and we get additional provisions put in place formally and informally to include capacity building requirements, extended embargoes, collaboration environments. We still really don't know the effects of these additional steps that are being implemented and what their consequences are for the utility of data. So, coming on to the final points about what might be ways forward in addressing these challenges. It's just to mention that this is a complex and very fast-moving policy environment at the moment. So just in 2018, you can see we have some very broad-ranging privacy legislation in Europe and the POPI Act in South Africa. And these have breadth, just jurisdiction far beyond health data sharing, but they're fundamentally affecting how we share health-related data. We also have development, led by Catherine, of starting to get specific policies. So we have the GFBR guidelines on how we should share data in public health, data and samples in public health emergencies. And interestingly, we're seeing a preliminary consultation with the NIH, which you can contribute to up until the end of December. So this isn't a draft policy. This is asking for preliminary comments internationally. They said robust stakeholder responses about issues they should take into account when they're seeking to develop their new policy for data sharing and data management. So within this complex and rapidly moving environment, we also still have a number of gaps. A number of guidelines, a focus specifically, we have about 101 guidelines specifically on privacy, examples of legislation, and another 40 of regulation that specifically focus on privacy. But we still don't have a lot of material about how we should share samples and biobanking. We have some mention of it coming into the SIOMS, International SIOMS guidelines, but there is still a considerable distance to go, and we are working in a fast-paced and fragmented field. So, very briefly, priorities in this area have been recognised that we have governance, policies and processes that respect participants and communities, they minimise harms and promote benefits, and that's still a challenging area given our lack of empirical evidence about what those are, that they recognise and they're appropriately responsive to multiple stakeholder needs, and that they promote equitable sharing, and that the policies themselves need to be trustworthy, trusted, they need to be fair, transparent, proportionate, and relevant to the context from which data is shared. So finally, in the light of this brief run-through of multiple issues related to sharing samples and biobanking, questions arise about what might be ways forward. And there's an opportunity. We have so much expertise in this room from so many research contexts and so many fascinating case studies and policy papers to consider, first of all, the issues that are arising in practice on the ground that haven't yet been considered in international discussions about how we share data and biosamples. So are there things that have been missed yet? They're just simply not on the platform of international discussions. And the second thing is maybe to consider how these points, these challenges that have been well identified, how they might be appropriately addressed in specific contexts, and how these might differ between what the contexts are and how these learnings can be shared and contributed, and what the implications are for policy and practice. So that's quite a lot to do in the discussions over the next couple of days, and it's now my pleasure to hand over to Akin, who's going to discuss exactly how these issues have been addressed in a particular case. Thank you very much.